Every option is on the table as the House of Representatives works to get the bill passed by the end of this week. Even a measure which wouldn't require an actual vote is being considered. Perhaps further proof of the dysfunction ruling Washington these days. So what happened to the real goal of getting Americans quality coverage? For answers, I spoke with Democratic Congresswoman Debbie Wasserman Schultz from Capitol Hill. Congresswoman, has it really come to the point where an issue of this important that it's been debated not really just for a year but for 40 years in America, faces the prospect of being passed without members of the House of Representatives even having a vote on it?
Well, no. We have voted on health care reform repeatedly and debating and discussing it for about a year now. The Senate bill that we will vote on, that will be included in the rules package, has been voted on and passed by 60 vote margin in the Senate. We've passed a House bill, and now what we're going to be doing is passing this rule, including the Senate bill, and then the changes that will be the final product will be passed in a separate reconciliation bill with an up or down vote.
But you can see how members of the American public are looking at what's happening in Congress and thinking, here is a huge change to American life, and we are having this piece of parliamentary rules introduced at the last minute. Where is Washington putting its stand? Why aren't they actually putting a yes or a no vote on this important piece of legislation?
Katty, we have repeatedly put a yes and or a no vote on legislation. The House passed a bill, the Senate passed a bill. We are going to pass changes to the Senate bill, and the Senate bill will be passed when we pass the rule. Just keep in mind that if you go back to 2005, 2006, both of those years, 36 times the Republicans, when they were in charge, used this similar process to pass significant legislation. This is not a trick. This is just a procedural vote that will ensure that we can get our business done and get to the underlying changes that need to be made to reconcile the two bills.
But I'm sure you can step back a bit and see that this feeds into the perception that Washington is incapable of action unless it's done in this manner. I mean, it does feed into the dissatisfaction that people are having with the procedure here in Washington.
Well, honestly, I think what people care about more, Katty, is the content of the bills. The fact that we're going to finally pass legislation that will ensure that insurance companies can't drop people for having a pre-existing condition or deny them coverage for when they're sick. Make sure that we can get rid of annual and lifetime caps for health care benefits and close the Medicare Part D donut hole and put doctors and patients in the driver's seat, as opposed to the insurance companies who essentially have a profit-driven motive and control the whole ball of wax right now, and that is about to come to an end. That's what they care about. You're
prepared to say yes to the Senate bill. You'd be prepared to put your name to it. Why are some of your colleagues who voted yes for the House bill now not prepared to vote yes again? It's almost like they want it passed, but they don't want to leave their fingers on it.
Well, they're prepared to do that for the same reason that I am, and that's because in the reconciliation bill that we will pass following the rule, we will make sure that the changes that address our concerns in the Senate bill, because most House members liked our House product better, are adopted in legislation, and make sure that the bill that eventually is signed by the President has those changes and addresses our concerns.
And at the same time, we have a report out today that a quarter of all Californians are without health insurance. If this bill is passed, how many of them will get health insurance?
This bill will cover 31 million Americans that don't have health care right now, and even more important, it'll cover with security and stability the 85% of Americans that have health insurance but that face skyrocketing premiums, particularly for small business owners who are trying to provide coverage to their employees in a difficult economic times where they're having to choose often between layoffs and continuing to provide benefits. Bringing costs down and doing those things, that's what people in California and all across this country are finally going to get in this legislation.
Congresswoman Wasserman Schultz, thank you so much for joining me.
Thank you, Katty.